Audio recording for this meeting has begun.
Welcome to the webinar, Increasing Subsidy Payments and Setting Rates, including Cost of Care, Requirements and Options. My name is Elisa Gasvini, and I serve as the Infant Toddler Subject Matter Expert at the National Center on Subsidy Innovation and Accountability. Next slide, please. I'm joined today by my colleague here at the Center, Julie Ingersoll. Julie is our Equal Access Subject Matter Expert. We encourage everyone to respond to the questions in the pod below your screen as we begin the webinar. As a reminder, you can enlarge your screen by clicking the full screen emblem in the upper right-hand corner. Next slide. The topic for this webinar, Increasing Subsidy Payments, is one of the priorities identified in the American Rescue Plan Act. Supplemental discretionary funds can be used to address rates or support costs associated with the rate setting process. For example, conducting a cost study. We will be including a link to an ARP Act implementation guide, strategies to increase base payment rates in the chat box shortly. Data gathering and rate setting are also important components, ensuring eligible families and children have access to child care services comparable to those provided to families not eligible for CCDF assistance or child care under any other federal, state, territory, or tribal program. As you know, the equal access provisions are foundational to the primary goals of the CCDF program, improving low-income families' economic well-being and supporting children's development through access to high-quality child care. We are happy today to see many tribes participating in the webinar, and we note that all tribal lead agencies are exempt from the requirement to use a market rate survey or alternative methodology to set provider payment rates. Many tribes depend on the state's market rate survey to inform their rates, and while exempt from the market rate survey requirements, tribal lead agencies must set sufficient base payment rates to provide equal access to the full range of child care services and set rates that cover the cost of providing higher quality care. At a minimum, tribes with large allocations must show how payment rates are adequate, including a description of how payment rates are established. Tribal lead agencies, at their option, may still conduct a market rate survey or alternative methodology, or use the state's data to set payment rates. We hope this webinar assists tribes in understanding price and cost data gathering, whether collecting their own or using state data. Next slide. Increasing subsidy payments requires careful data gathering and analysis to support the rate setting process and rate increases. And here's an overview of our planned agenda for our time together this afternoon. We will address requirements and options you have in planning, collection, analysis, and decision-making processes connected to rate setting. As we get started, we'll look and see if we have anyone that's added anything to the question pod. Next slide. So one of our questions had to do with what do you find most challenging, and addressing what providers consider to be quality activities that are not included in our QRS. So it's part of that whole cost, how to cost intangible qualities of the program. That's really good discussion item. Also, in the alternative methodology, it looks like Washington State is in the process of developing an alternative methodology. So we're glad to hear that. We encourage you to use the chat throughout this webinar presentation to add other comments and questions. And we're going to try to address as many of them as we can during the webinar. And we will keep tabs on those questions that require policy guidance follow-up with the Office of Child Care. It looks like CMMI is also looking at an alternative methodology. Thanks for adding that. That's great. All right, we're going to move on to the next slide. So, you know, the Office of Child Care's Child Care Technical Assistance Network offers a number of individual, universal, or group technical assistance events to support lead agencies in implementing their CCDF fund. We are highlighting today an opportunity to submit an online TA request while you're thinking about it and in the subject matter. So as always, lead agencies can request additional technical assistance on any topic related to the ARP Act or other CCDF topics by contacting your regional office, your state system specialist, or your tribal child care capacity building center TA specialist. And they will coordinate with the Office of Child Care National Technical Assistance Centers to provide the support you need. And as always, technical assistance services are funded by the Office of Child Care, and there is no fee to any lead agencies. So you will see we've dropped in links where you can click and submit a TA request. There is one link for states and territories and a separate link for tribes. And now I'm going to hand off the presentation to my colleague, Julie Ingersoll.
Thank you for that, Elisa. Good morning, good afternoon, and good day, everyone. I'm going to be covering a lot of information in a fairly short period of time today, so we really value you taking time as questions surface now and throughout our hour together to post those questions in the chat. We're going to be compiling those and following back up with everyone on those. But I am going to be covering a lot of information pretty quickly. You're probably definitely going to be able to recognize my voice in a crowded airport someday by the time I finish with this presentation. And while it's going to probably feel like an overwhelming amount at times, just rest assured that there's going to be ample follow-up and support available to you in the weeks and months ahead. So let's go ahead and get started. One of the things we just want to acknowledge out of the chute is that there are two distinct steps in setting subsidy rates. Increasing provider payment rates is a federal priority and a goal of many lead agencies. Today we are going to focus on one area of that process, the data gathering needed for rate setting. Lead agencies consult with your stakeholders, and you may collect data about child care prices, child care costs, or both. These studies are typically conducted by researchers or staff within the CCDF agency or in a university or other research organization with which the lead agency contracts. Yet we acknowledge there is a second step, the actual process of setting or changing rates. Lead agencies have multiple mechanisms for establishing payment rates. The rate setting process may be shared between the legislature and CCDF lead agency, but is seldom if ever delegated to an outside organization. Rate setting is often a political process in which multiple stakeholders may participate, including provider groups, unions, advocacy organizations, legislative leaders, as well as CCDF agency staff. Rate setting relies in part, although not fully, on information gathered through a study. Next slide, please. We're going to cover over the next few minutes the actual requirements of the data collection process for rate setting. Next slide, please. What data do you need? Well, we'll talk about the first two items in more detail in a moment. The bullets under Other on the right-hand side are data you will need as a part of the summary of data and facts you describe in the CCDF plan to explain your efforts in assuring equal access, and that you use to assure your payment practices mirror the generally accepted practices in your state or territory. We'll touch on those briefly towards the end of the presentation. Next slide, please. Market rate survey or the alternative methodology, regardless of which approach you select, the required elements of the narrow cost analysis must always be done. Timeframes for the data gathering for the fiscal year 22-24 plan are listed at the bottom of the slide, along with the deadline to complete your work if under a waiver. This means that your market rate survey or alternative methodology are complete, as well as the analysis and the detailed report. Next slide. The descriptors on the slide give us a common grounding in terminology. As you all well know, providers know what they charge. They don't always know their full cost of business. That's why it's often easier to conduct a market rate survey than complete a cost study. Next slide. In my humble opinion, this is perhaps the most important slide in the whole presentation, engaging your stakeholders before your studies. The CCDF plan asks you to explain how you consulted with the required stakeholders shown on the slide, the State Advisory Council or a similar coordinating body, the local child care program administrators, your child care resource and referral agencies, the organizations that represent caregivers, teachers, and directors, and other entities as appropriate to your state or territory or tribal area. Of course, it should go without saying, but needs to be said. Your tribal grantee administrators should be partners in these conversations as well. The most important word on this slide is before. Before you begin your data gathering efforts, whether via a market rate survey or alternative methodology, you must consult. Though this seems like a no-brainer, it's a step that can easily be skipped over or not given its due diligence. Efforts to include provider communities are especially important in the process, particularly engaging providers who reflect the types of market categories you want to survey or model. Lead agencies are encouraged to, among other efforts, engage your stakeholders early in the process, have them review cost estimates as you begin to gather them, seek their input on the final detailed report. You all know your provider community and stakeholders and can determine the appropriate level of engagement. The key element is to engage them at an early juncture so they can give advice, review the proposed approach, and provide suggestions on getting data. This engagement is an art, not a science. Just remember, it's not simply asking them to read the completed detailed report before you post it. And you'll want to keep track of the comments and suggestions of your stakeholders, as you'll need to address in your detailed report how those were taken into consideration. Next slide, please. You get to decide which study to pursue, a market rate survey or an alternative methodology. And again, your stakeholders can give you valuable counsel on that. We typically think of market rate surveys as a study of prices and alternative methodologies as a study of costs. While this is often the case, an alternative methodology is not limited to this approach. Lead agencies may seek approval for an alternative methodology that does not incorporate costs, but rather other factors the lead agency has identified as valuable to informing rate setting. As you can see, the majority of the expectations for conducting a market rate survey or an alternative methodology are similar. A key element in their similarity is that they both require a statistically valid and reliable study. ACF has established a set of benchmarks to identify the components of a valid and reliable market rate survey. These are outlined in the CCDF preprint. To be considered valid and reliable, a market rate survey or approved alternative methodology must meet the following. It has to represent the price child care market. It has to provide complete and current data. You must use rigorous data collection procedures. It needs to reflect geographic variations. And you have to analyze the data in a manner that captures other relevant differences. We'll continue to emphasize today that the data from either the market rate survey or the alternative methodology must still be reviewed in the context of your analysis of the gaps between rates and costs for base and higher quality care in setting your subsidy rates. The key word for pursuing an alternative methodology, pre-approval. You must have pre-approval of your approach prior to implementing your studies. Lead agencies are encouraged to build into their planning a sufficient time period for the review and approval process to occur with both your regional office staff partners and then the final review approval by OCC staff. And you should anticipate it taking more than a week as you build out your timelines. As a reminder, advance approval is not required if the lead agency plans to implement both a market rate survey and an alternative methodology. Next slide, please. Comparing narrow cost analysis and alternative methodologies. These are terms that are often used interchangeably, yet they are typically two different efforts. The alternative methodology is a very rigorous gathering and study or analysis of different provider types, serving varying ages and within different geographies. As we said earlier, the alternative approach must still meet the statistically valid and reliable benchmarks as the market rate survey. A narrow cost analysis is used to gauge the gaps between the subsidy rates and what it costs to provide care at the base level, in other words, meeting the health and safety and staffing requirements, among others, as well as the costs supporting higher levels of quality. We'll address this in more detail later in the presentation. However, though I said a few moments ago that they are typically different efforts, it is possible, as noted at the top of the slide, to incorporate the expectations of a narrow cost analysis within the alternative methodology approach. In other words, if the alternative methodology includes that analysis that gauges the gap between your subsidy rates at both the base level costs and costs for supporting higher levels of quality, then that would also satisfy the requirement to conduct the narrow cost analysis. Next slide, please. You'll recall we mentioned earlier that one option is to conduct both a study of prices charged and a study of costs within an alternative methodology. The expectations within the studies are similar and both can yield valuable information for your rate setting process. Noting the content in the shaded box, demonstrating that payment rates afford equal access is ultimately the goal of all the required data collection. In accomplishing this, lead agencies will need to consider the cost and effort involved in conducting price and cost surveys or using a cost estimation model, including the potential need for contracted support from researchers outside of the lead agency, as well as engaging technical assistance. Next slide, please. Next slide, please. We're going to just briefly touch on market rate surveys. Next slide, please. Thank you. We are not going to spend time today discussing how to conduct market rate surveys for price gathering, though we are encouraging you to review a number of resources we have available on the NCSIA page, as shown here on the OCC website. This is just a sampling of what's available. There are a host of resources. If you see in that infographic there on the right under Equal Access Resources by the pie chart, there are a host of resources that we encourage you to seek out and review. These resources can be used to either strengthen your current efforts or help inform you more about this overall process, especially if you're new to the market rate survey or the narrow cost analysis effort. Staff at NCSIA are available to provide you feedback on how to strengthen your previous market rate survey or your current draft tool, as well as discuss any other aspects of conducting a market rate survey. Next slide, please. We're going to start a discussion now about narrow cost analysis. As we mentioned previously, the narrow cost analysis estimates and analyzes the cost to providers of delivering child care services that meet basic health, safety, quality, and staffing requirements at both the base level of care and at higher quality care. At each level of quality, however, quality is determined by the lead agency. That's probably about the third time now I've emphasized that, so hopefully a little of that is starting to sink in. A resource you may find helpful to review or re-review is the guidance on estimating and reporting the costs of child care. This is found with the other equal access resources on the site that we just reviewed on the NCSIA site, and we'll include a link in the chat as well. The analysis within the narrow cost analysis must identify the gaps between the cost of care and subsidy rates and then be considered as a part of the rate setting process. Next slide. But fear not, lead agencies have a lot of flexibility in performing this analysis. When the requirement for a narrow cost analysis first came out, you may have heard this referred to as doing a back of an envelope analysis. We've evolved in our understanding and efforts, but one thing remains true. You can determine how rigorous an analysis you conduct and from what sources you pull data. You might use the cost information you gathered as part of your ARP stabilization grant process. You might gather statewide data on general salaries, as salaries generally represent about 70% of the cost of care. You might include specific questions on your market rate survey, or you may pull together provider focus groups. It's up to you. While there are no benchmarks per se for a narrow cost analysis, as there are for a market rate survey or alternative methodology, you need to be able to articulate what you've done and how it's informed or helped to justify the rates. Lead agencies aren't required, at least yet, to set rates based solely on cost of care, but you can't ignore cost information either. You have to set your rates informed by that information. Next slide, please. This is just one possible method or example of cost modeling. It's among many you may outline, but it just gives us a flavor, an idea of what a cost modeling approach might look like. It's more rigorous than simply estimating on the back of an envelope, but also not as rigorous as a fully developed cost survey or cost estimation effort could be. As you can see on the slide, it's always about convening stakeholders first. That is just critically important. And in this example, we're using existing studies, such as wage studies that were already completed. We're receiving guidance from providers on assumptions for default estimates on cost. We're using ratios and group sizes, along with other non-staff related cost estimates for looking at costs at the base level care. We're looking at costs for increasingly higher achievement of quality. And we're reviewing for gaps in the estimates of costs to the subsidy rates. Again, this is just one example just to give you a flavor of a flow of how this process might lay out. This is not an example for you to copy and paste, but it just gives you an idea of a cost modeling method. Next slide, please. We've already discussed that one purpose of conducting a narrow cost analysis is to compare the estimated cost of care with the lead agency's current subsidy rates. This is not only a federal requirement and has been reported in your CCDF plan, but it also allows lead agencies to understand the impact of their rates on the provider's bottom line. There's other nuanced information that you can glean from a narrow cost analysis that can also prove useful in your overall efforts. It can help target rate increases where gaps are largest. It can inform a longer-term strategic plan for increasing rates, identifying where gaps are greatest, or supporting across-the-board increases if rates are systemically low. It can inform a lead agency's TA plan to improve provider business practices and strengthen providers' understanding of budget and service provisions to maximize revenues, among other business improvements. It can help everyone to understand the impact that different quality levels have on costs providers incur. And it can provide you with valuable information to share with policymakers, employers, business leaders, your philanthropists, on how much it is really costing providers to offer quality care, and not just what it is costing parents to pay for the care. Understanding the gaps between rates and costs may also spur lead agencies to consider other policy changes that support providers' bottom lines. One such policy is paying providers based on enrollment rather than reducing subsidy payments if a child is not attending care due to common causes such as illness or vacations. But that's a topic for another day. Hopefully coming soon to a theater or webinar near you in March. So stay tuned for more information on that. Next slide, please. Thank you. We're going to start digging more now into some of the various approaches of alternative methodologies. First, we're going to focus on cost surveys. Oftentimes, when we think of alternative methodologies, we think cost modeling. However, that is not the only method for conducting an alternative methodology. A cost model is one method. A cost survey is another approach. Some may include both, some level of surveying and then plugging that information into a model. Some approaches to alternative methodologies may not include costs at all. It is up to the lead agency to determine their approach to their proposed alternative methodology. Collecting cost data through a cost survey shares similar issues as a market rate survey in terms of the importance of the survey sample and the data collection methodology to achieve valid and reliable findings. A representative sample is key for ensuring that all provider types are well represented and that important dimensions of variation are captured, such as geography, provider types, and type of care. The data collection method, particularly the instrument used to obtain cost information from providers, is critical for ensuring that that cost data is reliable and valid. While there are considerations and challenges certainly with conducting cost surveys with providers, many can be alleviated or reduced with upfront technical assistance and extra support to providers. Some things for you to consider in exploring a cost survey. Surveying is more resource intensive to the lead agency oftentimes because of time needed for agency staff or on-the-ground support, and can be more onerous on providers to supply cost information. Providers may not have the data requested on their costs or have difficulty responding accurately or providing backup documentation. Providers may have difficulty calculating costs by age of child, as they may capture costs in an aggregate. And in turn, it may be difficult to estimate costs per child or per child hour. It may also be challenging to determine how to allocate reported overhead costs that are incurred if a program is embedded within a host organization. But don't let those challenges or considerations prematurely deter you. It can be done. Lead agencies or your research partners may find it useful to review the Office of Planning, Research, and Evaluation, or OPRE's 2018 report, Market Rate Surveys and Alternative Methods of Data Collection and Analysis to Inform Subsidy Payment Rates. We're going to put a link to that report in the chat for you. If you haven't had a chance to take a look at that, really encourage you to do that and share that with your partners. Next slide, please. Another approach to alternative methodologies is the cost estimation model. As the first sentence on the slide indicates, a cost estimation model involves establishing a set of parameters that define the type and structural features of the care environment being modeled and the cost of the associated inputs given those assumptions. I don't know about you folks, but that's a brainful for me. In many cost estimation tools, the cost and revenue estimations typically are computed at the program level on an annual basis. Variation in total costs are driven primarily by the salary and benefit numbers used in the calculations, which are based either on default values provided in a calculator or on values inserted by the user. Other typical program costs are also included in the cost calculations, such as rent, utilities, materials and supplies, food, and insurance. Cost models are ideally derived from underlying data on cost structures for the providers in the community being modeled. Therefore, a cost survey, even on a small scale, may be needed to inform the development and ongoing updates of the cost estimation model, especially when giving credence to geographic variations in costs. Next slide, please. Given the challenges of conducting a cost survey, using a cost calculator or cost estimation model is potentially a less costly option to provide valid estimates of costs, either on average or for a hypothetical provider that is based on a set of standard assumptions about the program and the cost of inputs. As a method to understand the different components of cost, a cost estimating tool like the Provider Cost of Quality Calculator, or PCQC, is extremely useful. The PCQC was designed to provide estimates of the differences in costs for different quality levels and to compare those costs to estimated revenues. The quality levels are reflected in assumptions made in the cost calculation about variables such as salary and benefit levels, staffing ratio, supplemental staff positions, and other inputs. The cost tool walks the user through a series of data collection spreadsheets that help the user understand the factors driving costs. However, in the PCQC and many estimating tools, the user must still make many decisions that will influence the final total cost estimates. I'm going to address just a few of those real briefly. One of the biggest challenges in cost estimating within child care is that the assumptions about the size and mix of classrooms and ages are critically important to the total cost numbers. Using the number of classrooms and age mix in a typical center yields one estimate of costs. Changing the number of infant rooms or the total rooms will yield different cost per child estimates. Testing different scenarios or different assumptions about program structures may be important to develop cost estimates that are valid across a range of programs found in a state, territory, or local area. Though there is little research or published guidance on how to choose these numbers and the assumptions to make, consulting with a variety of stakeholders is very important to ensure the scenarios are representative of child care provider circumstances. There is also technical assistance available to help in making these decisions. Lead agencies may also benefit from reviewing other lead agencies' cost modeling reports. as well as reviewing their own licensing data to develop a better understanding of the range of sizes of centers and homes in the provider pool. Another major consideration is how estimates of costs from a cost estimation model or tool will be converted or used as a comparison with your subsidy payment rates. Subsidy payment rates are typically denominated on a per time unit and per child basis. In cost tools like the PCQC, annual cost estimates are provided at the program level. Converting from an annual program cost to a per child per unit of time basis requires several assumptions about the time and care. As an example, if the annual cost per child is simply divided by 2,500, 50 hours per week for 50 weeks, the per hour cost may be above or below the program's hourly price. There is no standard guidance on how to convert from annual to per hour costs when modeling program costs, but there are national experts, technical assistance, and peer experiences that can help guide you. We know, for example, that the District of Columbia and New Mexico are two lead agencies that have successfully completed cost-based alternative methodologies. And we can tell from our chat that others are starting to engage in that process as well. In addition, the CCDF rule requires lead agencies to provide cost estimates that account for geographic variation, category of provider, and age of child. Cost tools like the PCQC provide separate cost estimates and calculations for both centers and family providers, and can provide different estimates by geographic area if one enters different cost numbers, again for things like salary and rents, for each geographic area. Therefore, lead agencies may need to have information on differences in those cost drivers for different sub-state, sub-territory, or sub-jurisdictional areas. Or you may discover that there really is no variation across your payment regions. Salaries may be one example. I think I just recently heard New Mexico present that as they were looking at salaries across their state, they really weren't finding a lot of geographic variation there. For some lead agencies, understanding how these assumptions influence the cost estimates may require the support of a consultant and a request for some additional technical assistance. Next slide, please. This is the tool I just referenced and has been used for, among other uses, assisting with narrow cost analysis and in determining costs of quality for rate setting. It's been used for developing or better understanding the costs of adjustments being made to quality rating and improvement systems, or QRIS, and for helping to quantify financial support needed for tiered reimbursements related to a QRIS. A brief was also published in December of 2020 highlighting this resource as a valuable tool in estimating the economic impacts of COVID on child care providers. You can find both the tool and the brief on the OCC website, and again, the links will be put in the chat. The National Center on Early Childhood Quality Assurance can provide you a great deal of support in the use of this tool. Just please be sure to follow your protocols for accessing TA through your regional office, your state system specialist, or your TA specialist. Next slide, please. The questions on the slide above, on the slide in front of you, have come up as more states have considered conducting cost-based alternative methodologies. In some cases, there are not quote-unquote correct answers. In other cases, we may be able to learn from others who have or are going down this path of approach. Let's take a few moments to consider the questions, as they may spark additional conversations for you and your partners as you explore more deeply various approaches to data gathering. I'll start up in the upper left-hand corner there. Does a cost-based alternative methodology really help us find the true cost of care? Unlike conducting a market rate survey where providers most often have one published price, they charge for care for different ages, and that rate can easily be compared to other prices. There are many different costs that the various providers may have. Different salaries, different occupancy costs, different in-kind supports, and different methods of grouping children by age group as examples. As you are learning and conducting a cost-based alternative methodology, there are many subjective assumptions that lead agencies make in estimating cost of care. Should you estimate based on actual costs of care or the value of costs of care? And what does value of cost of care really mean? This question is best answered by you, depending on your goals for conducting a cost-based alternative methodology. Typically, in looking at actual costs for salaries, you'd use wages and benefits. However, value of cost might factor in what constitutes a living wage, or given our collective belief that child care providers are underpaid, using the average salary of a pre-K or kindergarten teacher, for example. Some states are interested in providing parity for all their early care and early childhood programs within their state or territory or tribal regions. So they may use the cost for salaries for kindergarten teachers, for example, when estimating the value of the service and estimating true costs. Will I really find differences in costs across geographical areas? Again, this is an important question for all lead agencies to explore by gathering data across your various and different rate regions. Perhaps costs are similar across the geographies, and you'll find that maybe your rate regions can be collapsed due to those similarities. Do I still need to conduct a market rate survey? Before evaluating the type of study you plan to conduct, you may want to ask yourself whether you still want to gather information on what providers are charging the private market. Some lead agencies want this information so they can model expected revenue in a cost model. For others, they may want this price information for other purposes, for it still tells a very valuable story about your provider communities and the markets. And it may help you to gauge the impact of the private market if subsidy rates are ultimately increased. Remember, if you are already going to gather price information through a statistically valid and reliable market rate survey, even if you gather it through administrative means, it may not be necessary to seek pre-approval for also conducting the alternative methodology. How do I go about getting this pre-approval for an alternative methodology? Well, the answer to this can be found first and foremost in the most recent preprint, but second, we're also going to take a look at that requirement in the next slide. Don't go to the next slide yet. What if, for heaven's sakes, I find that certain types of ages or care are less than subsidy? Lead agencies who indicate they plan to base their rates on cost of care may be surprised to find, in some cases, that for certain populations, cost of care may be less than the subsidy being paid. One example I often hear cited is some providers make money on school-age care because of the allowable higher ratios. Therefore, the cost of care may actually be less than the subsidy payment. You will want to be prepared to address how you will adjust or not subsidy rates in this situation. It may be wise not to box yourself into a corner by stating that you plan to base rates solely on cost of care. Another approach to communication might be that you will be taking cost of care under significant consideration in setting your rates. And the last box on the slide, will there be an adverse effect on the private market if rates are set based on cost of care? The possible impact on the private pay market is one to anticipate, but lead agencies may not necessarily know what the effect might be. Again, your stakeholders, including your providers, may be able to offer valuable anticipatory guidance on this. And so I still can't encourage you enough to engage stakeholders not just at the start of the process, but throughout. Lead agencies may want to anticipate how they'll handle any adverse effects and prepare themselves for further analysis. Other approaches may be to explore differentials or add-ons that can support unique costs or the state or territory's need for certain types of care. Or you may want to adopt policies that allow providers to receive more than their private rate within the allowable CCDF and state or territory parameters, of course, so that providers don't necessarily have to increase their rates for private clients to maximize the higher subsidy rates available to them. Next slide, please. These are the requirements for the pre-approval that you have to seek prior to conducting an alternative methodology. These were outlined in the program instruction for the fiscal year 22-24 CCDF plan preprint. As we will note, lead agencies need to address 10 items in the request for an ACF pre-approval for an alternative methodology. Though it's last on this slide, I can't emphasize enough, it's really number one, that consultation with your required stakeholders prior to conducting any approach. I just really can't emphasize how important it will be and how time-saving and valuable it will be to do that front-end work. You're obviously also going to provide an overview of your proposed approach, including the data sources you plan to use. You'll describe the difficulties you believe you would have or the limitations you would have in being able to obtain the same information from the required narrow cost analysis. Next slide, please. You're going to provide the assurance of how your approach is going to be statistically valid and reliable. You'll account for key factors that impact the cost of providing care. Many of those are highlighted on the slide in front of you. You'll also assure that you're going to capture the universe of providers. Next slide, please. You'll describe how your approach is going to reflect the required variations by provider type, age of child, geographic location, and quality. You're, of course, going to ensure that you'll absolutely use current data. You'll describe the metrics the lead agency is going to use to set the rates. And you'll describe the estimated reporting burden on providers and the cost to conduct the approach. As you can see by these 10 elements, it's more than a sticky note of good ideas, but it also doesn't have to be a daunting or terrifying process. Next slide, please. So, how does all this effort culminate before you get to rate setting? Requirements are pretty straightforward as far as content of the report. You are compiling all that you gathered, the results of your analysis, and the input, as well as your responses to that input that you received when you consulted with your stakeholders. Yes, prior to starting your efforts, and hopefully throughout the process. Once you have all of this work compiled into a report, you need to make it widely available to your public, including at a minimum posting it online within 30 days of completion. Next slide, please. There is additional data and information that you have to gather to satisfy the equal access section of your CCDF plan that all go towards ensuring equal access for our families. Two key areas that I just want to highlight here are, if your policies allow providers to charge parents beyond the subsidy reimbursement and co-payment, what many of us refer to as the hidden co-payment, you need to determine with data, not a gut check or with anecdotes, the extent to which that's occurring and be able to address this in your CCDF plan, including data on the size and frequency of these amounts. If you do allow this practice, you'll also need to provide an analysis of how this doesn't impede access and promotes affordability for the families we serve. Also, if you do not pay in part-time or full-time increments, or you do not pay registration fees, you'll have to have data sufficient to justify that these payment practices do in fact mirror that of your private pay market. This data gathering doesn't have to be part of your MRS if you feel that it will add additional burden to providers or reduce your response rate, which is also critically important for your valid and reliable study. You can gather it via your market rate survey, of course, but you can also pull from other areas such as your CCR&R data, your own administrative data, and provider satisfaction surveys. There is an infographic titled Preparing Your CCDF Plan, Required Equal Access Data that's available on the Equal Access resource page that we viewed earlier that's on the OCC website. You may find this useful to print and keep handy as a reference or to share with your stakeholders in preparation of your data gathering efforts. Again, we'll put a link to that in the chat as well. Whew. Okay, you all may be getting very tired of hearing my voice, and my voice is getting tired of talking. We've covered a lot of ground today. Rest assured there is help out there through your regional office and the technical assistance in the various national TA centers. Now that you've heard so much from me, we want to learn more from you. We've captured your questions and your comments from the chat pod at the start of the presentation and throughout the presentation, and we will be reviewing those with the OCC staff and determining methods to get responses back to all of you. We'd like to spend a few moments now giving you an opportunity to let us know what your additional questions or wonderings are, to share with us the successful strategies that you've used to engage stakeholders, for as you've probably now surmised, that is an essential part to this process. And we'd also be very interested in hearing any planning or ideas you have for using your supplemental discretionary money to increase rates. We'd really like to ask you to take time now to start to insert your questions or comments into the pods. I'm going to turn this over to Elisa in just a moment, but in closing, I'd just like to add that gathering data on cost of care is not an option for lead agencies. The choice comes down to conducting a market rate survey or a cost-based alternative methodology and incorporating a narrow cost analysis with either of these choices. I want to thank you all for your attention today, as I know it was a lot of information, and I assure you there will be follow-up opportunities as we go forward. For the benefit of the children, families, and providers in your state, territory, jurisdiction, or tribe, we wish you much success in these efforts. Elisa, I'm going to turn it back over to you.
Thank you, Julie. I'm not seeing any additional questions that are being entered. We'll give everyone a minute here if you want to add anything to these question pods. We would really love to hear from you. I see some people are typing, so let's see. I know a question we had earlier was just some confusion about the difference between a cost analysis and a narrow cost analysis. I think Julie went over that several ways, but if that is still not clear to anyone, please enter that. There's a question, will there be a transcript of this session, as well as when will the recording be available? And yes, we will have a transcript. It needs to go through 508 compliance, and then we will post it. And I think the recording will be available to all participants. I'm looking to see if any of my colleagues are correcting me on that. Yes, it was a tremendous amount of new material for some, Kevin, and we appreciate you hanging in there with us until the end. And yes, I've gotten clarification that everyone will receive the access to the audio if you would like it, and we will be posting the slides once they're 508 compliant. Okay, and I'm not seeing anything else, so we're asking you to hold on for one more minute, and we'll go to the next slide. We have some evaluation questions. Oh, and just a reminder, again, you can submit here. You can submit a request for technical assistance right now. And you will see over on the side the links for states and territories, as well as the link for a tribal TA request. So please use those if you would like some more individualized assistance. We'll be glad to help you. And we appreciate everyone completing the evaluation. And as Julie said, thank you so much for your participation today. We are here to continue to provide TA around this topic.